Hi, this is Dr. Cook from the Addiction Files podcast. I wanted to talk to you about an episode we recorded in about the end of September 2023 on overamping with stimulants and what this means. Overamping with stimulants is basically another term for overdosing on stimulants, or the effect that people experience when they take so much stimulant drug that their body literally feels overamped. So blood pressure goes up, heart rate goes up. They may have intense feelings of restlessness, agitation, and psychiatric and psychological effects of the stimulant may be extreme, such as extreme paranoia, agitation, hallucinations, etc. So we talk about overdose when we refer to opioids, but we are not talking enough about overdose effects with stimulants. Stimulants do have a deadly effect on the body in terms of risk of cardiac infarction. So in other words, heart attack, stroke, extreme high blood pressure, and arrhythmias. So irregular heartbeat. And we need to warn folks who are using stimulants that if they have chest pain, rapid heart rate, irregular heartbeat, palpitations, shortness of breath, extreme headache, vision change, that their stimulant use may be to the level where their body is experiencing this toxic effect. Now, obviously, stimulant use is not good for you anyway, but this is a harm reduction approach to educate patients and to be aware that too much stimulant could be deadly, and we want to educate them to seek help and also encourage them to seek treatment for their stimulant use disorder. So, overamping, what does it look like? It can look like high blood pressure, rapid heart rate, dilated pupils, diaphoresis, which is sweating, irregular heart rate, psychosis, paranoia. What does it feel like? It feels like rapid heart rate, palpitations, chest pain, shortness of breath, headache, vision change, excessive sweating, paranoia, hallucinations. What can we do about it? Well, encourage people to seek treatment for their stimulant use disorder. Use a test dose or less in the beginning than they think. Know the set and setting that they're using their stimulant, especially being aware of using stimulants after several days in a row without getting sleep can increase the effect of overamping. Using stimulants in the setting of dehydration and malnutrition can cause overamping, and using stimulants in the setting of other drugs can cause overamping. Again, using stimulants when you are physically unwell can also cause this problem. So can we encourage folks to use less, use a test dose, make sure they're taking care of their physical bodies, eating well, sleeping well, in a setting where they feel safe and secure. And then if they have any of these symptoms, to seek out medical assistance immediately. If they have any symptoms of opioid overdose, of course, we know that stimulants are now frequently contaminated with fentanyl or other synthetic opioids. So having naloxone on hand and understanding how to use that and recognizing opioid overdose is also extremely important. So that's a brief summary and look at stimulant overdose, otherwise known as overamping. For more information, listen to our entire podcast episode on overamping. It's available on YouTube. It's available on all other streaming platforms where our podcast is published. Send us comments and follow us on our podcast for lots of other topics in addiction medicine.